which committees I think we're helping. Also that statewide programs spread the risk. And, you know, there's been a lot of discussions in the past on particular regions and regional variations, and certainly we track and monitor those things. But when you're talking about a group benefits program of over 500,000 people, you do have a lot of ability to manage costs in terms of some of the programs that we put in place, as well as negotiate with hospitals and providers and vendors associated with it. Our other lesson learned is that incentives versus disincentives, voluntary incentives are not working with our particular population. We have a number of programs in place that we talk about in terms of wellness, and only about 1.2% of our population has taken the health risk assessment. The health risk assessment in and of itself is not the end to the means, but rather it is a tool by which you can start managing your care and managing your health. It also helps focus you on maybe a center of excellence or maybe some place that can help you take care of your condition. And only about 29% of the population is participating in any of our disease management programs. 1,500 people are participating in weight management, and yet we know that there are about 16,000 employees that have a BMI of 35 or greater.
Representative Bowden.
The health risk assessment, is that a paper tool, or is that going to a facility and having health risk assessment done by a person?
It's an online tool. It's an online tool that gives you at least a high-level questions to fill out then that points you to various directions depending on the answers to those questions.
See, I don't read the stuff y'all send either, so, you know, because I'm one of your people.
We can certainly provide you the link.
No. Yeah. That's why I didn't know. I get it. I go,
And only about 54 people are using our tobacco cessation program. So one of the things that we do know is that so far, as much as we try to advertise, as much as we try to encourage people to participate in wellness initiatives, that voluntary incentives, including things like gift cards, that if you take your health risk assessment and you report your weight management for a certain amount of weeks, then you're eligible for types of incentives do not seem to be working with the general population.
Representative Hobson, and then see, is it Truitt? Okay, Hobson.
Thank you. You know, when we went and talked about the bariatric surgery last year for employees that are on deal, have we had enough time to figure out if we saved money yet or not?
Well, actually, what we're going to present to the Board of Trustees May 25th is a plan design for bariatric surgery. So they haven't adopted it yet, but we anticipate that they'll adopt it May 25th. It'll go in effect in September.
And we'll keep up and really see if it does save us money.
Absolutely. And there will be requirements. It won't be just automatic.
Okay. And as if I remember right now, it's for employees only, not spouses.
Yes, sir.
Okay, thank you.
Okay. Vicki?
I just want clarification on 29% of the identified population is participating in disease management program. That's 29% that we know really ought to be in it, or 29% of employees?
No, 29 based on claims data and analyzing claims data. That 29% of the people are participating. For instance, I got a phone call that said, you know, by the way, here's a program that may be a benefit to you, and it's up to you to participate or not participate. And including, there are other programs that we do as well. When you hit certain age targets, you do outreach to say, here's the types of wellness checks that you have once you reach age 50 or 55 or 60 for your age group and your gender. And so in addition to not only the disease management programs, we also try to do outreach for wellness as well. So what do we do about it? And then policy considerations. And some of the policy considerations that you may be hearing about in the future are looking at contribution strategies based on healthy lifestyles, encouraging healthy lifestyles, including tobacco user penalties, incentive to participate in disease management. We've been doing a lot of surveying of our members, a lot of talking to our members and listening to what they had to say, and a lot of them say that they would be interested in us looking at those things in the future. One of the questions I asked earlier was about network strategies, looking at tiered networks. We already have an in-network, out-of-network, out-of-area network, but rather looking at tiered networks based on not only cost but quality of services.
Representative Coleman?
I heard something about disincentives. You mean like people smoking or weighing it? What else?
The one most common is the tobacco.
Okay.
The most common.
If it's
is the one.
legal,
I'm sorry?
it's legal. The
Yes.
state taxes it.
Yes.
It actually encourages it.
And in terms of the health care plan, Blue Cross Blue Shield, it's not saying that it's not
really,
illegal.
I think, I'll just be honest with you, I think that's a slippery slope. Next thing, we'll be charging people by the pound.
I understand.
I mean, are you,
I think that proposal was actually brought forward a couple of years ago. And so, no, it is a slippery slope. It is certainly a slippery slope. There's just a policy consideration that I think the point that we're bringing up is that it's open for debate, open for discussion, and if this is the will of the legislature in terms of managing cost or shifting cost, then that's something that we'll have to look at how to do if that's what the legislature chooses to do.
so your recommendation to the legislature, or you're saying you just have several policy options that the legislature can, I mean, pretty soon, if you have a certain illness, then you'll pay a higher premium, right?
I think that what we asked was, what would you like us to study? We asked our membership, what would you like us to study? And this is one of the things that they indicated they would like us to look into.
But if I'm healthy, that's the first thing I do, is I say I want you to charge the potentially sick people more. We just went through this on a national debate. It just sounds backwards to me.
And that's why the wellness is so important. We
Well,
think the
it is,
wellness
and when we
programs
went
are so
through this a
important.
couple of years ago, we talked about incentives for wellness. And those incentives were where we would go, because you don't penalize people for their health or lack thereof.
And we just wish that more people would take advantage of the wellness programs and the incentives available to them.
So carrot's not good enough, so now...
It hasn't in this, all I can say is what happens in this program. And it has not been uniformly accepted in the program to have incentives. And, you know, of course, it's just like, as you pointed out, if I do something, it's not a big deal or a big cost. So I don't think about the whole cost of the plan or the program. If 500,000 people do it, then it starts adding up.
Then that creates ratings. I mean, literally, that's the start of a rating of a patient and a person paying a rating based on age, based on everything.
And that's why we try to not talk about regional variations and
Okay, I'm just sounding
the
the
group
alarm,
benefit
folks.
Group benefit programs.
That's like driving. It's like everything. Be wary of that.
some of the other policy considerations are tightly managed care. Some of the things that were talked about earlier were prior authorizations for things like high-tech radiology. As Ted said earlier, what we have right now is a soft edit or a notification. The ability for plans out there to do prior authorization is certainly something that people consider. Going to mandatory step therapy, going to mandatory therapeutic substitution for drugs is certainly something that people consider in terms of managing the cost of health care, as well as medication compliance programs. All these things are things that people have brought up. We certainly are listening to both our members as well as other companies who suggest ideas, and we try to explore each one of them as they come forward and give you feedback on what works and what doesn't work.
What kind of response did you get from your questionnaire that came out? I know I participated in it. I'm just curious what kind of response rate